What they do not know is who regulates them in Australia, what those regulators require, and what happens when something goes wrong. This is the gap this series closes. And this first week is the foundation for everything that follows. Let me be very clear about the scope so that you use your study time well. This series does not teach you clinical dentistry. It will not teach you restorative techniques. It will not teach you endodontics. It will not teach you diagnosis. Your clinical textbooks and your clinical courses already do that job. And they do it better than I could in a video. What this series teaches is the layer that sits on top of your clinical knowledge. Who regulates Australian dentistry? What those bodies require from you? And what happens if you get it wrong? This material is examinable in the written exam, particularly in the domains called professionalism, ethics and law, and practice in an Australian context. It is also tested throughout the practical exam because your professional behavior is marked there too. Everything I teach in this series comes from official regulator sources: the Dental Board of Australia, AHPRA, the Australian Dental Council, the National Health and Medical Research Council, the Therapeutic Goods Administration, APANSA, and the state and territory regulators. I'll give you the source websites as we go so that you can read the original document if you want to. But I have written this so that reading those original PDFs is optional. You should not need to open a single primary document to follow along. Here is where we are going. This week, part 1, we cover the regulatory map, the national law, the registration standards, the scope of practice, and the code of conduct. Part 2 covers AHPRA in operation, notifications, complaints, mandatory reporting, the state differences in New South Wales and Queensland, and advertising compliance. Part 3 covers infection prevention and control and the TGA's regulation of dental materials and devices. Part 4 covers radiation safety, workplace health and safety, dental records and privacy, and a single consolidated compliance checklist. So let us begin where every regulatory question begins. Who actually has power over you and what kind of power is it? Who actually have power over you? Australian dentistry is regulated through something called the National Registration and Accreditation Scheme. You will see it abbreviated at NRAS. That scheme was established under a piece of legislation called the Health Practitioner Regulation National Law. Every state and territory has adopted that law. The New South Wales and Queensland adopted it with some local changes, which creates what we call a co-regulatory model. We will cover that properly in part 2. Under this scheme, the responsibility for regulating you is split across several different bodies. And here is the important part. Confusing one body's role for another body's role is one of the most common traps in the exam. So I want you to learn this next section cold, not roughly, cold. The Dental Board of Australia, which we will call the DBA, is the standard setting body. The board sets the registration standards. It sets the codes and the guidelines. It does this for every division of dental practitioner, and there are 5 divisions: dentists, dental hygienist, dental therapist, oral health therapist, and dental prosthetist. The board registers practitioners, it registers students. It also decides on notifications that are referred to it. Now here is what the board is not. The board is not an administrative agency. It does not process your paperwork itself. It sets the rules. Somebody else does the administration. That somebody else is AHPRA, the Australian Health Practitioner Regulation Agency. AHPRA is the administrative and operational arm. It supports the Dental Board and 14 other national boards. AHPRA manages your application. AHPRA maintains the register. AHPRA receives notifications and investigates them. AHPRA runs the practitioner lookup that any member of the public can search. AHPRA also handles advertising compliance. And here is what AHPRA is not. AHPRA is not a standard setting body. AHPRA implements the board's standards. It does not write them. Let me give you a simple way to hold this. The board writes the rules. AHPRA runs the system. If a question asks who set a standard, the answer is the board. If a question asks who processed something or investigated something, the answer is AHPRA. The Australian Dental Council, the ADC, is the independent accreditation authority. The ADC accredits dental education program in Australia. It also assesses overseas trained practitioners, which is the process you are going through right now. The initial assessment, the written examination, and the practical examination are all ADC processes. Now listen carefully to what the ADC is not, because candidates get this wrong constantly. The ADC is not a registering body. Passing the ADC process makes you eligible. Passing the ADC process makes you eligible to apply for registration. It does not register you. The board and AHPRA register you. Those are two separate steps. The Australian Dental Association, the ADA, is the professionals' peak membership body. The ADA produces clinical guidelines, including well-known infection control guidelines. It produces policy statements. It does advocacy work for profession, and membership is voluntary. Here is what the ADA is not, and this one appears in exam questions regularly. The ADA is not a statutory regulator. The ADA cannot register you. The ADA cannot discipline you. The ADA cannot deregister you. It has no power over your registration at all. The TGA regulates medicines and medical devices under the Therapeutic Goods Act 1989. The dentistry that includes your dental materials, your instruments, implants, and whitening products. It also regulates how those products are advertised. What the TGA is not is a practitioner regulator. The TGA regulates products, not people. Remember that phrase, products, not people. ARPANSA is the Australian Radiation Protection and Nuclear Safety Agency. ARPANSA sets the national radiation protection codes, including the codes that cover dental radiation exposure. But ARPANSA does not license your practice. The actual licensing is done state by state. These are the bodies that actually license and regulate your X-ray equipment. Examples include the New South Wales EPA, the Victorian Department of Health, the Radiological Council in Western Australia, and the Health Protection Service in the ACT, Australian Capital Territory. And the rules genuinely differ between states. That is not a small technicality. We cover it properly in Part 4. These bodies enforce workplace health and safety, law for dental practice as a workplace and as an employer. Safe Work, New South Wales. WorkSafe Victoria. WorkSafe Western Australia. WHS Queensland. Here is the exam point. A work health and safety breach and a board notification are two completely different legal tracks. They can run at the same time about the same incident without one affecting the other. The National Health and Medical Research Council publishes the National Evidence-Based Infection Prevention and Control Guidelines. Those guidelines apply to all healthcare settings, including dental. But the NHMRC is not an enforcement body. It writes the guidelines. The dental board and the state health departments are what give those guidelines regulatory teeth. The Office of the Australian Information Commissioner, along with state privacy regulators, enforce the Privacy Act 1988 and the Australian Privacy Principles plus state health records legislation. That is what governs your patient records. Now let me give you something practical. There is a question structure that appears again and again in ADC scenario questions. It goes like this. A colleague or a staff member or you observes something. What is your obligation and to whom do you report it? To answer that correctly, you must know which body has jurisdiction over which type of concern. So here is your rule of thumb, and I want you to memorize it. A concern about a practitioner's conduct, performance or health goes to AHPRA as a notification to the board. A concern about a product or a device goes to TGA. A concern about radiation equipment goes to your state radiation regulator. A concern about workplace safety goes to your state work health and safety regulator. And a concern about a patient's care experience or a patient complaint goes to state health complaints entity and possibly to AHPRA depending on which state you are in. We cover that split in part 2.